Welcome, everyone. Thank you so much for joining us for this next episode of Aestique Plastic Surgeons Secrets to Looking Your Personal Best. And today we are going to be talking all about body contouring. Do you have stubborn fat that no matter how much diet and exercise, it just will not seem to go away? Or do you ever wish that you can take some fat from somewhere you don't want it and put it in a place that needs it? Well, you are not alone. Today we're going to talk about this and more, and we're going to dive into, is body contouring really the same thing as liposuction? Where on your body can you have this done? Can you combine liposuction with other procedures? And can you take the fat that you remove from an area that you had liposuction and put it somewhere else on your body? Joining me today is Dr. Lazzaro and Dr. Camp, Aestique Board Certified Plastic Surgeons, who are going to explain all of this great stuff to us today. So welcome both of you. So happy to be with you and have you here.
Well, thank you, and a very warm welcome to all of our visitors. We're happy to have you.
Yes, I'm looking forward to the webinar tonight. I think we have some good information to share.
And with that, we're going to go right into it. And Dr. Lazzaro, what exactly is body contouring? And is that really the same thing as the common term that we hear, liposuction?
This is a very common question, and there's been confusion with different types of procedures that have been done through the years. Liposuction is the term that most people are familiar with, and this is actually sucking fatty tissue out of the body. There has been many innovations that have come along. One of them has been using, along with suctioning the fat out, prior to doing that, using ultrasound to melt the fat prior to removing it. This had an added advantage of providing heat in the area, which would help the skin contract more and help the contouring. Also, it would liquefy the fat, so then when you did remove it, you would then have much less discomfort. Another addition that has come is then going superficially and separating the fatty tissue, which helped the contour even further. Here's a diagram which shows the cannula going under the skin, which is the, looks like little eye signs. That's the skin of the dermis into the fatty tissue. Now, if you would visualize, we would go under in that fatty tissue and use the ultrasound to melt that fat. You wouldn't want to go too superficial because, again, ultrasound emits heat. So you stayed away from being too close to the skin. And that's when the other modality of skin separation superficially we would do, which would even further enhance contouring procedure. So if we see the next slide, we'll look at liposuction being the term most people know. And when we add the third component, the second component of the ultrasound to melt this fat and the superficial separation, those three entities together are what we call liposculpturing. And it gives the best body contouring and the most control, especially in stubborn areas that have more fibrous tissue.
So when you talk about that, liposuction generally just means taking the fat out, but liposculpture, you're saying you actually sculpt those areas. So it really is truly a different technique.
Absolutely. And the technique, because we're doing two more things, we're melting the fat with the ultrasound and then superficially separating. The procedure takes longer to do, but the results are very well worth it because the contouring, I find through the years of doing the liposuction and then adding these two other modalities give me a much better contouring, which we'll demonstrate tonight.
And I would also think that, commonly we hear about people doing things full sculpting and the Zerona laser, but you can't get that liposculpture technique. You can't get the sculpturing. So in essence, it really is a different operation, and this is much more tailored to the person.
Oh, most definitely. And I think these other modalities, the allure and the attraction there is you can put something on and have this fat contour without having to have a surgical procedure. And in some modalities it works, but even in our plastic surgical literature, we have seen that there was what they call paradoxical. In other words, they didn't know the explanation of fat that had been removed by some of these modalities coming back later. With the liposculpture, when this fat is out, it's out. We take it out, we contour it, and this fat doesn't come back in those areas.
And some of these newer technologies, Brianna, they are applied through the skin surface and they penetrate downward. So you're really dependent upon the energy itself, the good quality of skin, and some patients do get burn injuries from those. And it also depends on the fat thickness. When we are doing the liposculpture, we're actually in the layer of fatty structure, we're feeling that layer, and we are sculpting and sensing with our hands on the outside and the cannula on the inside and getting the best uniformity. So we have less opportunity to have irregularities.
Well, that's very interesting and such good explanations, because people do ask about that a lot. So now that we talked about that, another important question that a lot of people want to know is, where can body contouring be done? Like anywhere on the body, certain spots?
So anywhere that there's lipodystrophy or areas of fatty deposit that just are resistant to diet and exercise, we can typically find those spots and contour them. But I would have to say that this is really where credentials do matter. With all of the years of surgical training, we understand and know the location of important nerves and vessels and how the planes of tissue change from one spot in the body to another spot in the body. And without that surgical training, you just don't appreciate the difference from one patient to the next. So credentials, being board certified plastic surgeon and having years of training, make me confident and Dr. Lazzaro confident that we can do liposculpture from head to toe, including chin, arms, breast, the axilla, clear down to the calves and the ankles, not only for contouring and shaping, but for improving that deep fatty layer as well.
Then let's get right into it, and we want to really start from the top down. So Dr. Lazzaro, if you can tell us about this first patient, start with the neck.
This is a common area that bothers a lot of people, women as well as gentlemen, where you get that double chin. They really don't like their contour. It's a resistant area. This is, as Dr. Camp mentioned, it's lipodystrophy, which means it's diet and exercise resistant. Going into this area, just with a small little opening under the chin, we can actually melt that fat and then suction it out and contouring. And you can see on this young lady, the jawline and the contour of the neck. And it seems like just a little difference there, and it is, but it's a big difference mentally on how much this really causes a lot of mental duress on people who have this area and just can't seem to get rid of it.
So going down the body, this is a patient who didn't like the changes of her upper arm despite diet and exercise. This lipodystrophy that hangs off the upper arm can be treated. In her case, she's young enough with good skin contractility, just 2 small puncture wounds near the axilla and then down near the elbow so that we can cross-hatch the way that we sculpt this fat to remove it. And you can see the bottom picture showing how great her skin has contracted, how much fat we were able to remove. And I think even the picture on her back really shows it even better, how wonderful that contour is. And this was liposuction alone. So our next series of pictures is, both men and women are concerned about their abdomen. We all want that nice hourglass shape with good contour at the waist, and men especially have these love handles and resistant fat around their belly button area. Just through small puncture holes, we can remove that fat, sculpt that body, give a good silhouette line down the side, and make this patient who's already athletic look more like he feels. So very thin and athletic on the front view. And again, the back view shows how we can even sculpt those muffin top love handles and get right to the spine to make him look as thin and athletic as he works out and should be.
And we actually have a question, Dr. Camp, if you could answer it. Chris is asking, once the fat is removed, is there a concern over sagging skin in that area where the fat used to be?
There can be, and that's a very good question. With age, our skin loses its elasticity, its contractility. We can see that in patients with pregnancy, how a young lady can retract that abdominal skin that was stretched so much, but then more mature women with pregnancy retain some of that extra stretched skin. It just doesn't go back the way it did when we were young. So during a personal consultation, we would assess the contractility of your skin, talk about how much of that layer deep to the skin we need to remove, and if your skin would be able to contract to be acceptable to you. And if not, then maybe it would need to be combined with some skin removal or even a staged procedure if the skin didn't contract the way that we expected it to.
It's a really great question. Thank you, Chris. So on the next one, Dr. Lazzaro, if you'd like to talk about this patient. This is the patient from the abdomen having her liposculpture there.
Well, as Dr. Camp mentioned, we do an assessment of the skin and to see where that is. And postpartum, when there's been pregnancies, oftentimes we can see that skin where it's not of the character that we will contract well with a lipo. This young lady had excellent skin, even though she had that little pudge around her belly button and that decrease, that projection of the area. This isn't something where it would necessitate doing anything more than the liposculpturing. The problem here really is the redundant fat. The skin is good, the underlying musculature is good, so you can see just contouring that area with the liposculpturing procedure, we can get a nice silhouette to the abdomen. And as we proceed on down further, take a look, if we look at a side view, saddlebags were actually the reason why liposculpture was developed. This was the main reason. This was developed in France, in Paris, by a Dr. Illouz many years ago, and it was primarily for saddlebags. And this is a good example of that, where you have that unwanted fat, where despite, you can see she's in good shape above, below, she has a little bit of that saddle bagging and a little bit of excessive fatty tissue on the inner thighs. So we can sculpt that area and actually transform the bottom of her body looking like the top and giving her that hourglass silhouette.
You had mentioned before that when you do this procedure, it does remove the fat cells. So this fat that you're calling the saddlebags around her hips and outer thighs, that's not going to return?
Absolutely, because there's been a myth that people say, well, gee, is it possible? Or sometime we heard that the fat, when you take it out of one area, it goes to another. Well, that truly is a myth. The fat, once that fat is out, it's out. Now, if you put on weight, you're going to put on weight in there, but you'll do it symmetrically with the rest of your body, as opposed to where people say, well, I would just eat something and it would go right into my thighs or right into my hips. That's because they have many more fat cells. Once we sculpt that out, the fat cell quantity is equilibrated, so you will symmetrically expand and not, it's not really going to any other areas.
We're going to keep moving down the body, Dr. Camp.
So this is one of those areas, Brianna, where I was saying how credentials really matter. You know, the skin on the inner thigh and the inner knee is much more delicate than the skin on the anterior and lateral thigh. And so we have to be a little bit more selective in our fat removal when we're working around the knees, the calves, and the ankles. These areas have tendency to show up irregularities more easily. So having a surgeon and physician who's board certified and well-trained, we can avoid some of those discrepancies that you can see with less trained physicians who offer this same service. And this lady with knee liposculpture has just had a great improvement. She didn't have skinny legs to start with, but she has more beautiful contour around the knee and really what she was looking for. So this patient also shows those zones of adherence that we were talking about, where her upper back fat and then the upper hip fat are separated by this deep crease. And that's where the skin is actually attaching down to the muscle through some fascia bands. So when we do that special technique now, the separating, the aspirating, the fat equalization, all these techniques also help us to release those zones of adherence, to equalize the fat along those planes. And then this beautiful contour that we see on the right, this hourglass silhouette, is achieved not only by the fat removal, but by helping those zones of adherence not be so strong, and the fat equalization to keep those lifted so they don't stick back down and give that back fat, lower back fat separation like she had before surgery.
Just to carry that even further, you can see what happens. This young lady has scoliosis, so the little curvature of the spine gives her that crease in her back. Many women don't like it all, and obviously without scoliosis you can have this on both sides, and that gives them that back boob. When they put their bra on, it pushes out. Here with the liposculpturing, we can go in, melt that fat, and go up on the back, and you can see you can get a much more hourglass, clear silhouette where the bottom of her body is in balance with the top. And if you notice on the pre-op picture, it almost doesn't look like she has a nice curvature to her buttock. And this actually, by taking that muffin top and contouring that area, we can actually give her the creation of the buttock. This is not a Brazilian butt lift, which Dr. Camp will discuss in a bit, but it's I call this the Italian butt lift, is where we subtract the fat in the areas we don't want it, and then it contours and makes the areas that are there look like they're in proportion and balance. I'll give you a look at this next young lady, and you can see the pre and the post-op looks pretty dramatic for her hourglass. And what makes it even more dramatic, that this post-op picture that you see on your right, where she has the nice silhouette to her figure, is 6 days post-op. This is when we're just removing the dressings. And you can see with this liposculpturing, you can see, now if the skin has the good elasticity, and this young lady is only 26 years old, you can see taking that fat out will contour, and it's not waiting for months and months for this to happen. You can see this in an early post-op stage. And finally, just to drive this home, again, you can see taking the fat out of the hips and the back gives her a beautiful silhouette, and where she didn't even look like she had any buttocks on the pre-op picture, where it's in harmony and she has a nice gentle curvature, and there's no fat put in anywhere in this young lady. This is all liposculpturing on the hips and the back.
It's a beautiful, beautiful result.
Just bringing it all together, and this is an early post-op, is taking it off the abdomen, the hips, contouring the thighs, and here was really lateral thighs. She wasn't concerned much with the medial. She has a little fullness where she's touching in medial, but that wasn't a concern. But you can see putting this together on someone who's older, who even had some children, had good skin tone, and we were able to contour her and give her a beautiful hourglass figure.
So those are all such amazing results, and that was just liposuction. Now, can you combine liposuction with other procedures?
The answer is most definitely. And again, we're saying liposuction. It's liposculpture when you're using it with the ultrasound and the superficial separation. But one common is, again, we showed you a lipo of the neck previously. Let's take a look at someone who has that fatty tissue in her neck, but also has a bit of a recession to her chin. So what we're going to do here is we're going to do a chin implant, and then you can see her aesthetic profile here, where the chin is in the right position. It even rolls up her lip just a little bit and puts it in the right anatomical space. And then simultaneously, we're doing liposculpture in the neck to give her a nice clean jawline. And this is the same exact thing on a gentleman. And men usually have a stronger prominence or like a good jaw angle. He has the fatty tissue in his neck, and we're going to lipo that and put in a chin implant at the same time. And you can see how it just brings his whole face into a more aesthetic, masculine balance.
Well, Dr. Camp, we've talked about the face, and something that's really exciting for people is that you can put this fat into the buttocks. So if you have a flat buttock, you can enhance it. You want to chat more about that with us?
Oh, that would be great. Thank you, Brianna, for that question. And in fact, Dr. Lazzaro talked about how we take that fat down from the hips, or muffin top, which is the common terminology. But some patients actually would like to have a bigger, more voluptuous shape to their buttock. So when we approach a patient such as this one, we want not only to do liposuction, but to do what we call lipo harvest. And that's a little bit different technique. It can take a little bit longer, but our goal is to remove the fat cell and keep it healthy and viable. So then we can take that same fat cell away from where you have the extra tissue and place it where you're lacking or where you have a little loss of fatty tissue. So this patient had the fat removed from the muffin top, and then we put it into her upper lateral buttock. And you can just see the beautiful line on her waist to butt, so much improved on the right-hand side. She loses that square look to the butt. It's now shapely and like an upside down heart shape. But when we look at her on her profile, it really shows the dimension of improvement of that whole silhouette, how her flat butt now has some just alluring curve to it. Not overdone, but just a beautiful shape. We've taken fat from where she didn't want it and put it where she needed to get better balance and a beautiful heart shape to her buttock. Well, let's look at another patient, Brianna, with similar findings. You can see on the left, she kind of has a square look to her buttock. The hip area, the upper thigh, all kind of squared off with the buttock, not much definition. So by taking down that muffin top, that hip roll, and then adding it to the buttock, we can see the picture on the right just shows such improved contour. And the little dark spot that's on her left upper hip, on the picture of the right, that would be an access site for where we were doing some of our lipo harvest. She's early stage of healing, so that pigmentation will improve with time. But when we see her on her side view or her oblique view, we can really get the full picture of how we just so improved that shape of her buttock, taking down that muffin top in the upper hip and adding it to a flat lower butt and just blending in her buttock cheek to the thigh and making it look more feminine and more heart-shaped.
Now, Dr. Camp, you pointed out this incision site. Is that all the bigger it is? It's very small.
We try to keep those little port, we call them port sites, about 3 millimeters, which is less than 1/4 of an inch, maybe about the width of your little fingernail for a lady's hand. Our cannulas range about that size. 3 to 4 millimeters is the maximum width of an incision, and they can heal very well, sometimes barely perceptible.
That's amazing. Now, Dr. Lazzaro, what if your skin isn't elastic enough? Can liposuction be done?
Absolutely. And this is a very common thing with women with pregnancies or when there's a large weight loss. If we look at our next young lady, she demonstrates this. We've actually showed her in a mommy makeover presentation because she so is exemplifying what we're doing in contouring. If you look at the front of the abdomen, she has fullness in the entire front, above her belly button and below her belly button. Actually, you can see her belly button, her umbilicus is protruding. She has a small umbilical hernia there. On the sides, she has fatty tissue on her hips. And if you look right under her bra in their back area, she has fatty tissue there. So we have a convexity on the profile where the belly is. So what's going on here is excessive skin, excessive fatty tissue, and separation of our muscles from pregnancy, which is very common with pregnancy. On the back, we see that fullness on her back as well as on the hips, on the side view and the front view. So we're going to combine procedures now. Actually, we've combined 3 procedures on her. We did an abdominoplasty, removing the excessive skin, and liposculpture to reduce the fat in her abdomen as well as on her hips and back. And while we were doing that, repaired her umbilical hernia. This portion of the surgery, and only this portion of the surgery, is something that actually can be covered by insurance. So we repaired it at the same time. Now, when you look at her post-ops, you're going to see all of that skin between the belly button and where we made the incision down low actually comes out. So the whole entire tattoo area will be removed. She has an innie instead of an outie from her hernia. We've sculpted the abdominal wall, and now you can see the hourglass figure from the liposculpting. An abdominoplasty by itself will not take care of that. The liposculpting would help contour her hips and her back. And you can appreciate this on a side view as well. What we were seeing her pre-op, we're going to get a flatter belly doing the tummy tuck, repair her hernia, and you also notice her buttock looks a lot better because we've sculpted the muffin top, the hips, and the back area. So we're using this in conjunction with another procedure to really enhance the body contouring.
Now, we did talk about being able to take that unwanted fat and putting it in the buttock to enhance. But what else can you do with that fat once it's removed?
This is probably the most exciting part of plastic surgery that Dr. Camp and I have seen. And this was actually developed by University of Pittsburgh by the doctor who was then chief of the plastic surgery department, who was no longer practicing plastic surgery, asked his very astute fellows, we're taking this fat out. Is there something that we can do with it? And they started experimenting and doing different things and finding out, and actually found that we can take this fat and put it in other parts of the body. And not only can we sculpt these other parts of the body, but that it also stays and it doesn't resorb. This has been a great innovation in plastic surgery. because now not only can we take fat out of where we don't want it, but we can contour and sculpt other areas that we want to. Case in point, let's look at this first gentleman. This is actually showing the logistics of it. When we take the fat out, years ago, you would have to take it out, send it out, prepare it, and get it, so you couldn't do this in real time. Now we can do that. We take the fat out, and in the upper layer is some oil, which we remove. In the lower layer is fluid, which we remove, and we just leave the fatty tissue. From here, we can transfer that fatty tissue into very tiny syringes, and through needle pricks, we can use this to sculpt other parts of the body. Let's look at this gentleman. Here, we're seeing him with a tired look under his eyes and deflation of the upper part of his face. So the fat that we've taken out in his saddlebag area, where Dr. Camp demonstrated that, the most common site for men, that spare tire, taking that fat out, instead of discarding it, we prepare it, and then just through needle picks, sculpt across his lower eyelids and build up his cheekbones, create a nice hourglass figure, a nice heart-shaped figure to his face, and puts him into much more balance. And by and large, this is permanent. The vast majority of this will last. Here he is on a 3/4 view. And taking this same thing and seeing it on someone on an attractive face where it just has a tired look. Look at this young lady. We were performing a breast augmentation, and she said, well, is there anything you can do around her face? Her face is beautiful. She doesn't like that she has the tired look around her lower eyes, and she really doesn't have prominent cheeks. She doesn't have that nice heart-shaped face. So while we were doing it, she didn't have much fat on her body. We were able to procure some fat and take it, harvest it from the inner thighs. So we helped contour the place there that she didn't like, and then transferred it to her lower lids and cheekbones. And you'll see post-op how this puts her whole face into much beautiful harmony. She goes from an attractive woman to a more attractive woman, a woman who looks like a model because she has that nice cheek prominence and the heart-shaped figure. And here she is on a 3/4 view, which exemplifies this nice. So this has been a very exciting part of plastic surgery, because now not only do we tailor and tighten things, but now we can actually sculpt it, and sculpt it with your own material, your own. There's no allergy and no rejection to any of this. So it really is a excellent time in plastic surgery, and exciting.
And those facial patients, they just look so refreshed, almost even younger. When I look at the gentleman you just showed, this beautiful young lady, they look more vibrant after the fat transfer to the face.
Absolutely. And without we're not tightening, we're sculpting it, and they will in turn age better. Because they will have more support in the areas and less chance for the skin to sag. So they will eventually need some tightening if they don't like that, but they will age better in the process.
And these were just two beautiful examples of fat transfer. But if you haven't seen the webinar we did a few weeks ago, please go to our YouTube channel. It's called Aestique Medical, and Dr. Camp and Dr. Lazzaro did a wonderful webinar called Wave That Magic Wand. I would highly recommend it. There's some great examples of fat transfer patients on there. And we talked earlier about the importance of, knowing who you're with. How do you know you're with the right person, with the right training? Dr. Lazzaro.
People say they've had procedures done by plastic surgeons when they may come to us and say they want to tweak something and they didn't like what happened. And when we drill down, it really wasn't a plastic surgeon. It was a cosmetic surgeon, and not that cosmetic surgeons can't get good results, but when people think they're someplace and they're not, the only way to ensure that is to look for the logos. The interlocking circles here you see on your left that means that person is certified by the American Board of Plastic Surgery. And now when you see the Aphrodite, the other logo to the right up top, that plastic surgeon has been certified in aesthetic or cosmetic surgery. So always look for these two logos to assure yourself that you're with a plastic surgeon who does a lot of the procedure that you're looking for. Our lower logo is that our facility, and you want that's important as well, is certified, and this is an accrediting body that accredits surgical centers.
And now we're going to jump to a couple more questions that are really common that people have. And one is liposculpture safe? Dr. Camp, what would you say to that question?
I again would defer back to the credentials being important, that if your surgeon is well trained as a surgeon, then the procedure itself can be very safe. But anytime we cut the skin, there can be a risk of infection, bleeding, and scarring. But the surgeon who is well trained will know where those important vessels are, where those important neurovascular bundles are, can do fat transfer with very little complication and risk. And you should feel very confident that going to a board-certified plastic surgeon, you can achieve good, safe results with liposuction and liposculpture.
And another common question we hear people asking is it a painful procedure?
The beauty of this with using the ultrasound, again, in melting the fat and then taking it out, makes this much less discomforting. And many patients come back and, geez, they will say, boy, I've heard that from a friend who had this, that they had a lot of discomfort for a while, and they're delightfully surprised. And they say, gee, I didn't have much discomfort at all. Now, everybody has different discomfort levels and tolerance, but by and large, this is not a uncomfortable procedure. And as you can see, we do it through tiny incisions, so there isn't large incisions to heal. So it also minimizes not only your discomfort, but your downtime.
How about, speaking of downtime, how long is that recovery period for someone?
So I would say that recovery really, Brianna, is a staged thing. So after surgery, that first 24 hours, we really don't want you driving or doing anything that would require good mental acuity. You've just had anesthesia. But most patients who have this liposuction procedure are feeling pretty good, just even by day 3 to 4. We put you in a compression garment, and underneath that garment, we have added protective barriers of foam tape and some topical foam just to keep you from having excessive swelling. Then when we see you back at 1 week, we'll take the garment down and take all that dressing off. And by that 1 week time frame, I think patients are really feeling back to normal daily activity, not working out, not doing excessive, increase your heart rate type activity, but just to do self-care and daily around the house things that would be a normal routine are very fine by 1 week. We do have you wear the garment for up to 6 weeks, so swelling can persist in some locations where we do liposuction.
And the garment we like is that nice spandexy contouring, and this actually helps the skin contour and assume the contour that we're both striving for.
And another great value added that you get at Aestique is when you have this liposculpture procedure, you have a value added of lymphatic massages that are provided. Dr. Lazzaro, can you talk a little bit about what the lymphatic massage is and what it does for someone who has the liposculpture procedure?
I'm so happy you brought that up. We believe lymphatic drainage afterwards really helps the contouring, and it also helps the comfort of the patients. I mean, they are literally amazed. We include that as part of the procedure when we do the liposculpturing. Patients love it. So they'll have a couple of treatments of this, and then we find they're even going back on their own to do other treatments now, not so much even for the lymphatic, but for the body contouring and the massaging they enjoy as well.
His patients certainly love it. It's one of their favorite perks of the after. Well, this has all been wonderful, and we would love to carry on the conversation with you. I know Dr. Lazzaro and Dr. Camp would be happy to see you either in the office or with a virtual consultation. And you can schedule that by emailing info@aestique.com. We can work out a date and time that suits you best and have you be able to talk to one of the surgeons. And also, as a gift for joining our webinar today, you will be receiving $500 off of your surgical procedure. And just some reminders, we next week have another wonderful webinar on June 4th at 7 p.m. And this is going to be with Dr. Camp talking all about breast procedures. So Dr. Camp, could you tell us a little bit about what we're going to be hearing next week?
Well, our chest area is such a defining part of our figure for both men and women that we just wanted to talk about the global surgical approaches to improve the breast area. Even gynecomastia for men can be very insecure in feeling when these areas are just out of normal. So anything from a reduction for a large-breasted woman, breast augmentation, maybe your implants are old and you want them removed, and we can talk about how to lift the skin, or even to complement the breast shape with a fat transfer. We also want to talk about breast reconstruction for our patients who unfortunately may have breast cancer and have had to have a breast lumpectomy or breast removal and could need some reconstruction. So we're going to hit A to Z on breast procedures next week.
And again, that'll be on Thursday, June 4th at 7 p.m. And you can go right onto our page at Aestique.com and sign up for the complimentary webinar. And as always, Dr. Lazzaro and Dr. Camp, thank you so much. I know I'm speaking for everybody when I say we so enjoy these webinars and all of the great information and photos that you provide us to see. So would you like to say anything and close?
Well, I want to thank everyone for attending as well, and sincere wishes for best health for you and your family, and look forward to seeing or hearing from you in the future.
And I look forward to meeting you, whether face-to-face consultation or virtual consultation. We are available and ready to schedule at your convenience.
Thank you all so much for joining us on this latest episode of Aestique Plastic Surgeons Spilling Their Secrets, all about body contouring. And please follow us on social media. For those of you who may not know, we did create a new social media platform that is totally dedicated to the plastic surgical practice. And you'll see here, it's Aestique Plastic Surgery. That's our Facebook, also same name for our Instagram. And like our page and share with 5 friends, you can be entered to win an iPad. And again, it's going to be great content. We're going to do some Facebook Live, Instagram Lives, showing some great videos and before and afters. So thank you very much for joining us. We're really happy to have you. We hope that you have a wonderful weekend and look forward to seeing you next week. Thanks again, and we hope we help you live life counterclockwise. Good night.